Ladies and gentlemen, please rise for the presentation of graduates.
Love yours. Love yours. No such thing. No such thing as a life that's better than yours. No such thing as a life that's better than yours. Love yours. No such thing as a life that's better than yours. No such thing, no such thing. Heart beating fast, let it know that he alive. Fake niggas, mad snakes in the grass, let him know that he arrived. Don't be sleeping on your level, cause it's beauty in the struggle. Goes for all y'all. It's beauty in the struggle. Yeah. It's beauty in the struggle, ugliness in the success. Hear my words and listen to my signal of distress. I grew up in the city and know sometimes we had less. Compared to somebody who's down the block, man, we were blessed. And life can't be no fairy tale, no once upon a time. But I be right there if it don't be trying. So tell me, mama, please, why you be drinking all the time? Does all the pain we brought you still linger in your mind? This pain still lingers on mine.
Thank you. You may be seated. Good morning, everyone. Good morning. My name is Dr. Vanessa Stroman, and I am the Occupational Therapy Assistant Program Director here at Eastern New Mexico University, Roswell. On behalf of ENMU-Roswell and the Occupational Therapy Assistant Program, welcome to the Class of 2026 pinning ceremony. Today is a day of celebration, reflection, gratitude, and transformation. We gather not only to honor academic achievement, but to recognize something deeper: resilience, purpose, service, and the becoming of healers. To our graduates, families, loved ones, faculty, staff, fieldwork educators, honored guests, and community supporters, thank you for being here. Your presence matters. Your support helped carry these students to this moment. Families, your sacrifices, prayers, patience, and love are part of every pin that will be placed today. No one arrives at a day like this alone. And to our graduates, today we pause to recognize the road you have traveled. Not just the assignments, the exams, competencies, lab hours, and fieldwork requirements, but the inner work, the perseverance, the self-doubt you had to push through, the sacrifices you made, the moments you wanted to quit but chose to continue, the parts of yourselves that had to grow so that one day you could help others grow too. This ceremony also carries deep personal meaning for me. As many of you may or may not know, I endured a life-changing hospitalization. I experienced healthcare not from the classroom and not from the role of educator, but from the side of the patient. I was in the ICU. I coded. I was placed in coma. My family was told that I was not going to survive. And yet, by the grace of God, through skilled healthcare and through relentless perseverance, I am here. When I woke up, I faced the kind of reality that changes you forever. I had to relearn the most basic skills of life: how to speak, how to eat, how to use my hands, how to move, how to walk, how to participate in the very occupations that many of us take for granted. I know what it feels like when your body and your life suddenly become unfamiliar. I know what it feels like to be vulnerable, afraid, frustrated, and exhausted. I know what it feels like to need other people to believe in your recovery. before you are strong enough to believe in it yourself. And I also know what it means to encounter healthcare professionals who do more than treat, professionals who restore dignity, professionals who make room for hope, professionals who understand that healing is not only physical, it is emotional, it is mental, it is social, it is spiritual, it is occupational. That journey changed me. It deepened my gratitude for healthcare. It deepened my faith. It deepened my understanding of what it means to truly help another human being reclaim life. And it made me even more passionate about occupational therapy, because I did not just teach the value of this profession, I lived the need for it. Sitting before me is a class of future practitioners who will one day walk into rooms where someone is grieving the life they used to have. Someone who is scared, someone who is weak, someone who is hurting, someone who cannot yet see what is possible. And you will be called to help them rise. That is why the symbol of the phoenix feels so fitting for the ceremony. The phoenix is not powerful because it never burns. The phoenix is powerful because it rises from the ashes transformed. And that is what occupational therapy is so often privileged to witness. We meet people in the ashes after stroke, spinal cord injury, surgery, trauma, illness, mental health crisis, developmental challenges, loss, ICU stays, and life changes they never asked for. Through skilled interventions, compassion, adaptation, activity analysis, therapeutic use of self, and unwavering belief in human potential, we help build people, rebuild. We help them reclaim routines, recovery, identity, and return to the occupations that give life meaning. For those here today who may not fully know what occupational therapy is, and it's okay because a lot of us didn't know that's what we're going to become. I want to take a moment to educate the room because this profession deserves to be understood. When we say occupation and occupational therapy, we're not just talking about a job. We're talking about the meaningful activities people need to do, want to do, and are expected to do every day. Occupation and occupational therapy is getting out of bed. It is bathing and dressing. It is feeding yourself. It is brushing your teeth. It is writing your name. Learning in school. It is playing. It is caring for your family. It is driving. It is cooking. It is returning to work. It is participating in your home, your community, and your life with dignity and purpose. Occupational therapy helps people participate in those occupations across the lifespan. We serve infants, children, adolescents, adults, and older adults. We work with individuals, families, groups, and communities. We address physical health, mental health, cognition, sensory processing, development, habits, routines, roles, environments, and the skills needed for everyday life. Our scope is so beautiful. It's broad because human life is broad. Occupational therapy practitioners serve in acute care, intensive care, and post-ICU recovery, inpatient rehab, skilled nursing, home health, outpatient rehab, pediatrics, schools, mental and behavioral health, early intervention, community-based practice, assistive technology, wellness, and health and promotion, and aging in place. We help a child regulate and participate in school. We help a survivor of stroke learn to dress again. We help someone with a spinal cord injury adapt daily life. We help older adults remain safe and independent at home. We help people with mental health needs establish routines, coping, and participation in meaningful roles. We help patients restore not just movement, but function. Not just function, but identity. And not just identity, but hope. And occupational therapy assistants are essential to this work. OTAs are not just helpers in the background. They are skilled, compassionate practitioners who implement interventions, build that rapport with patients, observe progress, reinforce goals, grade and adapt activities, educate patients and families, collaborate with occupational therapists, and help turn treatment plans into lived recovery. As future occupational therapy assistants, you will help people do the hard and holy work of beginning again. You will be the one beside the patient when their hands tremble as they try to feed themselves again. You'll be there when someone takes their first steps after weakness or injury. You will be there when a child finally succeeds in a task that once felt impossible. You will be there when an older adult realizes they may be able to stay safely in their own home. You will be there when a person who has every reason to give up chooses instead to try one more time. And sometimes, whether anyone else in the room realizes it or not, you will be the person helping someone find the courage to fight for their life. Never underestimate the sacredness of that. I also want to take a moment to honor our fieldwork educators. Your impact cannot be overstated. You welcomed our students into real practice, real patients' lives, and real moments of vulnerability, progress, uncertainty, and triumph. You taught them not only how to document, observe, analyze activity, grade and adapt, maintain safety, communicate professionally, and think like practitioners. You taught them how to be present, how to carry responsibility, how to lead with compassion, how to respond when things do not go perfectly, how to remain ethical, flexible, and grounded in service. You gave them more than supervision. You gave them example. You showed them what occupational therapy looks like when it is lived with competence, humility, and heart. You helped bridge the distance between who they were when they entered this program and who they are becoming today. Thank you. Thank you for trusting them, challenging them, guiding them, and helping shape the next generation of occupational therapy practitioners. What you poured into them will ripple into every patient they serve. Thank you. I also want to recognize our OTA faculty, Mr. Samuel Chavez and Mrs. Sanders Aceves. Thank you for your work ethic, your dedication, and your unwavering commitment to student success. Thank you for the long hours no one sees. Thank you for the preparation, the reteaching, the feedback, the encouragement, the accountability, the compassion, and the high standards. Thank you for believing in our students even in moments when they struggle to believe in themselves. Thank you for showing up again and again with excellence and heart. Students, please know this. Faculty do not simply teach content, they carry vision, they carry responsibility, they carry the weight of preparing you to care for human lives. And our faculty have done that work with dedication and deep love for this profession. Now, I also want to say something about the prayer selected for today. As part of this ceremony, the students collectively selected their own prayer. That choice matters because spirituality is deeply connected to occupational therapy. Occupational therapy is holistic by nature. We do not see people as diagnoses. We see them as whole persons with values, beliefs, identities, roles, hopes, routines, relationships, and meaning. For many people, spirituality is part of what gives life meaning. It can be a source of comfort, identity, coping, resilience, belonging, and hope. In occupational therapy, we respect that. We recognize that spirituality may shape what matters most to a person, how they make sense of suffering, and what helps them continue forward. So today, as this class shares their prayer they chose, we honor not only tradition, but the human need for meaning, the need to believe that even in difficulty there is purpose, even in loss there is love, and even in ashes there can still be rising. That too is part of healing, and that brings us to the meaning of this ceremony. The pinning ceremony is more than a tradition. It is more than a formal event. It is a crossing point. It symbolizes successful completion of the Occupational Therapy Assistant program, but it also symbolizes commitment, responsibility, identity, service. It marks the moment when knowledge begins to take its place in the world through action. This pin represents long nights and early mornings. It represents check-offs, competencies, exams, study groups, tears, laughter, and perseverance. It represents the courage to keep going when the path felt hard. It represents ethical responsibility. It represents compassion in action. It represents professional identity and it represents the trust that patients and families will one day place in each of you. To the class of 2026, we are so proud of you. We have seen your grit, we have seen your growth, we have seen your kindness, we have seen your strength, we have seen your heart. This program asked much of you because this profession asks much of you. And still you rose. Like the phoenix, you did not become who you are without challenge. You became through challenge, pressure, sacrifice, refinement, and moments that stretched you beyond what felt comfortable. And now here you are, not at the end of your story, but at the threshold of it. Today is not the finish line, it is the beginning. Ahead of you are the patients whose lives will be changed by your words, your skill, your presence, your patience, your creativity, your encouragement, and your refusal to let them give up on themselves. One day someone will remember your name because you helped them hold a spoon again. One day someone will remember your face because you helped them transfer safely again. One day someone will remember your voice because you reminded them they were still capable. One day someone will remember your care because you met them in one of the hardest seasons of their life and helped them believe that life could still be meaningful. That is the power of occupational therapy. That is the calling you are stepping into. So as you move forward, practice with integrity, lead with compassion, remain teachable, stay grounded in evidence, advocate fiercely, protect dignity, honor the whole person, and never forget that our profession is not simply about helping people do tasks. It is about helping people live meaningful lives. Class of 2026, today we celebrate all you have done, all you have overcome, and all you are about to become. May you rise with strength, may you serve with humility, may you love this profession well, and may you carry the heart of occupational therapy into every life you touch. Congratulations. Thank you. As shared earlier, the students selected this prayer themselves in doing so. They chose to honor the importance of spirituality, meaning, and hope, all of which can play an important role in the healing journey and in the holistic care we provide as occupational therapy practitioners. Sean and Thamada, please come forward.
If you can all stand with me. Dear Heavenly Father, thank you for this day. Thank you for allowing us to be here. We thank you for the opportunities that you have given us to grow and excel both inside and outside of the classroom. We thank you for allowing our family and friends who have stood by our sides throughout this journey to join us today on this blessed day. We thank you, Father, for being right beside us throughout all of our late nights, stayed up studying for exams, all the challenges we face, and especially in our moments of doubt. We couldn't have made this dream a reality without you, Father, or without the friends and family who have been by our sides, who have cheered for us and encouraged us in this season. We ask you, Lord, for your guidance, wisdom, and strength as we transition into this next season of our lives. We ask that you guide our footsteps and that we use our gifts to make the world a better place for your kingdom. We ask for strength to navigate challenges, resist greed, and lead with integrity. We ask that you surround us with faithful friends and mentors who will encourage our growth. We pray in gratitude for our achievements, and we trust you with our future, and we ask that you bless us with courage and hope as we step into our future filled with your promise. In Jesus' name we pray. Amen.
Dios, hoy celebramos un logro más, que es solo el comienzo de nuestra carrera. Hemos aquí al final de un camino e inicio de otro. Gracias por la oportunidad de vivir y estar aquí para dar un paso más en nuestras vidas. Ayúdanos a ser gente de bien, luchadores inalcanzables de nuestros sueños y defensores de la verdad y la justicia. Te ofrecemos nuestro porvenir y nuestro camino para que nos guíes y nos traces el trayecto adecuado para tener una vida fructífera y vencedora. Ayúdanos a dar siempre lo mejor de nosotros, danos tu bendición en todo momento. Amén.
please remain standing for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You may all be seated.
Thank you. At this time, it is my honor to introduce our special guest speaker, Mr. Rudy Calderon. We are grateful for your presence today and for you taking the time to share in this special milestone as we honor the Occupational Therapy Assistant Class of 2026. Mr. Calderon.
Good morning. I would like once again to take the opportunity to welcome the ENMU staff, faculty, fieldwork educators, and family and friends of the graduating class of 2026. Before anything else, I want to express sincere gratitude to all of you who have supported these students along the way. Your encouragement, patience, and sacrifices have played a vital role in helping them reach this moment. This achievement does not belong to the graduates alone. It is shared with every person who stood beside them throughout this journey. Again, my name is Rudy Calderon. I've been an occupational therapy practitioner for 29 years. I myself sat on this stage back in 1997. Like many of you, I began as an occupational therapy assistant. And after 15 years, I continued my journey on to achieve become an occupational therapist. I've worked in public schools, outpatient clinics, early intervention, home health, and now serve as an occupational therapy supervisor at the New Mexico Rehabilitation Center. I also was allowed the privilege of joining the staff here as a part-time instructor when they needed some help, but they do an awesome job. I didn't realize how much work, how many hours they put in after classes to make sure you guys get a good quality education. They've done an amazing job. Can we give them a round of applause, please? Outside of work, I've been married to my wife Sylvia for 26 years. Together we raised 6 children and now enjoy 8 grandchildren. So when I speak to you today, I speak not just as a clinician, but as someone who's lived this journey. Occupational therapy is the use of self-care, work, and play activities to promote health, prevent disability, and increase independence. When people hear the word occupation, they often think of employment. But in our field, occupation refers to everyday activities that give life meaning, what we call activities of daily living. We help individuals regain independence after life-altering events such as strokes, spinal cord injuries, amputations, or surgeries. The tasks that many people take for granted, such as dressing, bathing, cooking, or simply moving safely through their day, are the tasks that we will work on. For children, we support development and success in the school setting. For all individuals across the lifespan, from newborns to those at the end of life, we help restore purpose, function, and dignity. Recently, a colleague who is actually a PT made this comment to me when we were working with a patient. She says, occupational therapy does not add years to your life, it adds life to your years. Today is just not about a degree, it's about perseverance. There were late nights, missed events, and moments of doubt. And those sacrifices didn't just come from you, they came from the people sitting beside or out here today. I remember myself going through graduate school with my wife at the same time while raising a family. Looking back, looking back, I'm still not sure how we managed, but we did. And those challenges made us stronger. So trust me when I say this, every sacrifice was worth it. Now you stand at a turning point. You've completed your level 2 fieldwork and you've seen what real practice looks like. But here's the truth. It's just the beginning. There will be moments when you question yourself. That's normal and necessary. Growth in this profession takes time and self-reflection. I often tell youth therapists, it takes about 2 or 3 years before you truly feel confident. So don't give up when the going gets tough. You'll get there. And even then, you never stop learning. Someone once told me, and it stuck with me for a long time, the more I learned, the more I realized how much I didn't know. So continue learning. Seek out mentors. I've had some really strong mentors in my life. Pat Herrera was a major influence in my life. She actually started this program back in the early 90s. When Dr. Stroman asked me to become a part-time instructor, I thought, man, this is going to be a piece of cake. I can do this. You know what? But without the strong mentorship of these 3 instructors sitting here, I would not have made it. And I've been around the block a few times. I thought I could do just about anything, but that was really an eye-opening situation. You know, surround your people who will challenge and support you. Because the therapist you become will depend on the effort you continue to invest. The journey of 1,000 miles begins with a single step. And today you're taking another step towards that journey. The core philosophy of occupational therapy is founded in the belief that meaningful occupation, everyday activities, is essential to health, well-being, and quality of life. It centers on the holistic, client-centered approach that views humans as occupational beings with an innate right to participate in activities that bring purpose and enable adaptation across their lifespan. It is critical to understand that you are not treating a diagnosis, but you are treating a person who has the diagnosis. While many of us have similar roles in our daily lives as parents, spouses, and employees, how we navigate through these daily roles is different for each individual. Having a good understanding of what is important to each client in their daily lives will be the guide to your selection of therapeutic interventions. It will be critical to listen to your clients to help you tease out important details of their daily lives to guide how you plan your treatment activities. One of Ms. Pat's favorite sayings was, "We are not wrapping Twinkies. If you want to wrap Twinkies, go work in the Twinkie factory." I once worked with a patient who suffered a stroke and completely lost all motivation. Despite our best efforts, nothing seemed to engage him. He'd just given up on life. That experience stayed with us as a team, as a rehab team, not because of what we accomplished with him, not because of what we accomplished, but because it reminded us how critical it is to connect therapy to what truly matters to the patient. You have accepted the calling to become a part of a profession in which you have chosen to help others. And I commend you on that decision. However, I must caution you that this will not always be easy. We are living in an ever-changing world, and you will be dealing with many situations that will challenge your own beliefs in ways you may not have dreamed possible. I've been spat upon, cussed at, and had to endure racial comments throughout my career, and maintaining one's composure can be very challenging during those situations. We must be able to set aside our own personal beliefs and biases when we are providing services to maintain our clients' confidence, not only in our ability to provide treatment, but in the fact that we respect them as individuals and we have their best interests at heart. We must support and encourage them to help them succeed through their treatment process. Unfortunately, sometimes death rears its ugly head and you just have to help them deal, the family and the patients deal with that too. You know, one situation kind of hit me really hard and, you know, touched me personally. We'd been providing services to a patient who experienced a CVA. We had started caregiver education with her daughter so that when she transitioned back home, we would increase her safety and independence. 2 days before this person was to go home, she lost her daughter in a vehicle accident. She was devastated. I could personally put myself in that person's shoes as we lost our youngest daughter in a motor vehicle accident. I was able to empathize on a personal level and tried my best to provide encouragement to help keep her moving forward. Using similar words and similar tactics that had been used to help me move forward from that day. You know, I remember Miss Pat, she had this calm and confident presence that just resonated well with others. I remember her checking up on my wife and myself during that time and using her OT skills to help us cope, especially after I told her I was ready to give up. You know, it was life-changing. But she also reminded me that while I had suffered a major loss, I still had a lot to live for. And that helped get me through, and it helps me get through today. You know, one black cloud that comes from that time is 2 weeks after the accident, I'd gone back to work. And there was a counselor there. You know, when I walked into work, she looked at me and she said she was sorry, but at least I had lost some weight. That was her response to my situation. I didn't even know how to respond to that comment. But I feel confident in saying that you, as practitioners, will never be as insensitive as that counselor. Another recent event involves a young man to whom we've been providing services. He'd suffered a traumatic brain injury and a stroke resulting from a major seizure. He was unable to speak and had paralysis in his right side. He'd been making good progress, started regaining his independence, and seemed to be headed to a good outcome. One afternoon, we just finished our therapy session and were returning him to his room. About 2 minutes later, he suffered another major seizure, and it required that we transfer him to a local hospital. His wife had been present during his entire stay and was starting to become educated on how to help him at home. She was beside herself. So while her husband was receiving medical care from the medical staff and our team, we had to try and calm her. Unfortunately, we found out the next morning that our patient had not survived. Needless to say, there was a black cloud over our team that day. You know, I was talking with a friend the other day and she said, I only do OT. You know, but I got a message here that I'd like to share with you, and then John will play a short video after this. But I want to share this message with you. My wife's mother, about 11 years ago, she was diagnosed with cancer. And the outcomes didn't look good. And before she went into surgery, I'm going to read you the message, but I want to give you a little background. Before she went into surgery, the doctor said, you know, she's not going to make it, but we can try giving her what's called prehab. Maybe that will help. Now, when they say that dynamite comes in small packages, my mother-in-law was about this tall, but man, she was feisty and could be very ornery. So when the doctor told my wife that he wanted her to have therapy, she already knew what to expect from, you know, how her mother was going to react to therapists coming in and helping her. So she told me, she said, I tried to find the orneriest and hard-headedest person I could find, and you came to mind. But this is what she wrote for me today. We want people to understand how truly life-changing occupational therapy can be. 11 years ago, our mother was diagnosed with lung cancer. Here in New Mexico, doctors told us that because she was 72 and had COPD, she would not survive treatment. They didn't even want to discuss a plan of care here in New Mexico. Physician in Lubbock referred us to a specialist in Dallas who agreed to take her case, but with one condition. She had to become strong enough to endure a 10-hour surgery to remove part of her lung. As a family, we knew this would take someone special, someone strong, someone who would push her while keeping her safe. So we turned to Rudy. Rudy worked with our mom with patience, strength, and unwavering encouragement. He pushed her on the hard days, lifted her when she struggled, and helped her believe she could do something that once felt impossible. The day of the surgery, the doctor warned us there was a 40 to 60% chance she might not make it. We prepared ourselves for the worst. But when we walked into her room afterwards, she was sitting up in a chair. No life support, just oxygen and IVs. Because of Rudy's care, and by the grace of God, we were given 8 more years with our mom. 8 more years of laughter, memories, and love. And for that, we will be forever grateful. Occupational therapy doesn't add years to your life. It adds life to your years. And I've got a video before I finish up that I'd like to share. So John, if you go, please.
Hi, my name is Patty, and today I want to talk to you about occupational therapy and how it has helped me get back into my normal everyday life. I was in a car accident last July, and I had multiple broken bones and multiple fractures. I broke my neck. I have 2 fractures on my pelvis. I broke my spine and 4 broken ribs. I mean, you name it. I had so many fractures that I was so scared that I was not going to be able to walk again, do my hair again, take a shower, put on my shirt. I mean, I could not move or put any weight on my leg. It was really scary. After I left the hospital, they sent me to a rehab place, and I was so scared to go there because I didn't know what to expect. But it was the best thing I could have ever done for myself. I went in, I had a wonderful therapist named Rudy, who was so wonderful, and he was tough as nails, and he was so hard on me, but it's exactly what I needed to be back where I needed to be, and be back to where, to normal, to my normal everyday life, and fulfilling my normal everyday tasks. The simple things like doing my hair, taking a shower, washing my hair, putting on my t-shirt, the simple things, a simple breakfast in the morning. That occupational therapy is so beneficial and so crucial in a recuperation to getting back home and doing your normal things that you do every day in life after a tragic event such as the one that I had. So I totally recommend Rudy, and I totally recommend occupational therapy. It's the best thing that I could have ever done to help me get back to my normal everyday life.
I showed that video to a poor worker the other day, and she said, how much did you pay her to have her say all those nice things about you? But I assure you I didn't pay her. It's all in her own words. Occupational therapy has evolved greatly since its founding in 1917, and it will continue to evolve throughout your career. Stay engaged in your profession. Be involved in professional organizations. Advocate for your role in healthcare. Maintain integrity. There may be times when you'll be asked to compromise your ethics. Don't. No job is worth losing your license. Protect your license, your reputation, and your patients. In smaller communities such as this one, your reputation will follow you. Be someone others can trust, someone who is dependable, ethical, and committed to patient care. As occupational therapists, you will work under the supervision of an occupational therapist. Embrace that collaboration. Again, seek out a good mentor. Be someone who is open to feedback and committed to growth. I used to work with a special ed director, and he used to tell me, I've got people with 20 years experience on my staff. And I've got people with 1 year experience 20 times on my staff as well. You have to decide which side of that comment you want to fall on. Nobody can do it for you. In closing, I want to leave you with this. You've chosen a profession that has the power to change lives. Not just physically, but emotionally and meaningfully. Continue learning. Continue growing. When the time is right, consider advancing your education. It will open even more doors for you. But most importantly, make this a great career or not. The choice is yours. Thank you for your time. Thank you for the class for inviting me to be their speaker. It's a great honor to be here today. Congratulations to the class of 2026 and to everyone who helped make this moment possible. Thank you.
Thank you, Rudy. Can we give him another round of applause? And now, everybody, we will be doing the OT Pledge and Creed. Graduates, can you please stand? Here you go. Reverently and earnestly do I pledge
wholehearted service in aiding those crippled in mind and body, to this end that my work for the sick may be successful. I will ever strive for greater knowledge, skill, and understanding in the discharge of my duties, in whatsoever position I may find myself. I solemnly declare that I will hold and keep inviolate whatever I may learn of the lives of the sick. I acknowledge the dignity of the cure of disease and the safeguarding of health, in which no act is menial or laborious. I walk in upright faithfulness and obedience to those under whose guidance I am to work in the holy ministry of broken minds and bodies.
Congratulations. Now for the pinning of graduates.
Sean Abeta, Soda Club President. José Ángel Caballero. Serena Michelle Flores. Cameron Alexis Lucero. Tamara López Muniz. Daisy Marie Sanchez. Catherine Sergin. Carla Rochelle Valverde. Mariah Vigil.
And now we're going to share some memories for class of 2026.
I wish somebody would've told me, babe. Some of these will be the good old days. All the love you forget, and all these reckless nights you regret. Someday soon your whole life's gonna change. Now it's the magic of these good old days.
I was thinking about the band. I was thinking about the bands. We were underground, loaded merch in that 12-passenger van in a small club in Minnesota, and the snow outside of First Ave. I just wanted my name in the star. Now look at where we at, still growing up, still growing up. I would lay in my bed and dream about what I'd become. Could I wait to get older? Could I wait to be some? Now that I'm here, wishing I was still young. Those good old days.
I wish somebody would've told me, babe, that someday these would be the good old days. All the love you won't forget, and all these reckless nights you won't regret. 'Cause someday soon your whole life's gonna change. You'll miss the magic of the good old days.
Wish I didn't think I had the answers. Wish I didn't drink all of that glass first. Wish I made it to homecoming. Got up the courage to ask her. Wish I would've gotten out of my shell. Wish I put the bottle back on that shelf. Wish I wouldn't have worried about what other people thought. I felt comfortable with myself. Rooftop open, and the stars above. Moment frozen, sneaking out and falling in love. Me, you, and that futon, we just begun. On the grass dreaming, figuring out
shouldn't change. You miss the magic of the good old days.
Never thought we'd get old. Maybe we're still young. Maybe you always look back and think it was better than it was. Maybe these are the moments. Maybe I've been missing what it's about. Been scared of the future, thinking about the past, while missing out on now. We've come so far. I guess I'm proud. And I ain't worried about the wrinkles around my smile. I got some scars. I've been around. I felt some pain and seen some things, but I'm here now. Those good old days.
Oh, you don't know. I close my eyes and I can see a world that's waiting up for me, that I call my own. Through the dark, through the door, through where no one's been before, but it feels like home. They can say it all sounds crazy. They can say I've lost my mind. I don't care, so call me crazy. We can live in a world that we design. 'Cause every night I lie in bed, the brightest colors fill my head. A million dreams are keeping me awake. I think of what the world could be, a vision of the one I see. A million dreams is all it's gonna take. Oh, a million dreams for the world we're gonna make. There's a house we can build. Every room inside is filled with things from far away. Special things I can buy, each one there to make you smile on a rainy day. They can say it all sounds crazy. They can say we've lost our minds. I don't care if they call us crazy. Run away to a world that we design.
Every night I lie in bed, the brightest colors fill my head. A million dreams keeping me awake. I think of what the world could be, a vision of the one I see. A million dreams is all it's gonna take. A million dreams for the world we're gonna make.
Windows down on my favorite street, sunset in the rear view, got nowhere to be. For a moment we feel like we're kings and queens, and nothing but a t-shirt or a dove jeans. We are free. Can you feel it too? It's not so clear. It's not all the and this is when the moments turn to memories. And this is when the future gets so clear to see. And this is when tonight this is when the moments turn to memories. And this is when the future gets so clear to see. And this is when tomorrow becomes a and this is when the moments turn to memories. And this is when the future gets so clear to see. And this is when tomorrow becomes a masterpiece. And this is when the moments turn to memories.
As our graduates come back onto stage, I want to thank them for sharing those very special moments. As we prepare to conclude today's ceremony, let us take one final moment to reflect on what this occasion represents. Today, we do not simply just celebrate the completion of a program. We celebrated resilience. We celebrated growth. We celebrated healing, and we celebrated service. And we celebrate the beginning of a profession devoted to helping others participate more fully in their life. To the class of 2026, may you go forward with confidence, with humility and compassion, and may you continue to grow into the practitioners that you have worked so hard to become. May you carry forward the lessons of this program, the guidance of your faculty, the wisdom of your fieldwork educators, and the love of those who stood beside you on this journey. May you remember, especially in those really hard, tough moments, that occupational therapy is a profession of hope. It is a profession that helps people rebuild after loss, re-engage after injury, and rediscover meaning after life has changed. And may you never forget that even when people feel that they are in the ashes of their lives, healing is still possible. Dignity is still possible, and participation is still possible. Rising is still possible. Congratulations on this well-earned achievement and on the meaningful path ahead. And thank you to all you family members and loved ones, faculty, staff, fieldwork educators, and guests for being here to celebrate this very special day.